Hi, good morning, everybody. This is Dr. Syed here. Yesterday, I had a patient, a mother basically, who was quite anxious, extremely anxious. She had brought her 3-year-old son, and her concern was that he's been having cough, blocked nose, running nose, on and off for the past few months. And recently, some doctor has diagnosed him with asthma. That was her concern, and she was extremely worried. She was anxious. She doesn't know what to do. She's in denial. She's not able to accept it, and she came straight away to me, and she wanted to understand what is this, what's happening. So she asked me this question, doctor, please tell me, is it asthma? Then I asked her a counter question. Madam, please tell me, what do you understand by asthma? Yeah, so her answer was that Doctor, asthma is that lung infection which can be there lifelong, which can make the child weak, and so on and so forth. She went on saying whatever she believed asthma was. Then I wanted to make her understand. In fact, through this video, I want to make each one of you understand, especially those who have such concern, who have a child who's been coughing on and off, who had history of wheezing, or who has been having a repeated blocked nose at night, mouth breathing, snoring episodes, heavy breathing when the cough becomes bad. Well, these all symptoms and signs come into the category of something called as reactive airway disease. Well, the word disease here is a misnomer because it's not a disease as such. It does not involve any bacteria, virus, or anything like that. It is basically an allergy of the respiratory system for any allergens. So, for example, we have skin allergy, right? Now we have got somebody who walks in the sun for a little longer. They get rashes, irritation, redness, itching, so on and so forth. So that is skin allergy. Yeah. In the same way, entire respiratory system in some people, in some kids, is allergic, is sensitive, maybe hypersensitive. So for some triggers, maybe dust, maybe smoke, maybe pollen, maybe any kind of allergens, it'll react. How does it react? The airway is made up of small tubes and large tubes, right? So we've got small tubes called as bronchioles inside the lungs, which will constrict for the external stimuli or the dust, smoke, whatever somebody exposed to, that it gets constricted. That is called as wheezing. The wheezing is what? Basically a musical sound produced by air which is moving through a narrow orifice. So it's like a flute. You play flute, you make sound. The flute, the diameter of the flute is widened, the music doesn't come, right? The wheeze is what? That is wheeze. So the air struggling to pass through a narrow airway, right? That is called as wheezing. So you must understand, is it a disease? No, it's not a disease. It's not a disease at all. It is an allergy. It is a reaction of the respiratory system. There could be multiple reasons. That it could be hereditary. Parents had it, grandparents had it, some close aunts, uncles had it. Child might have it. Or it can be sporadic, it can be random. In children who never had any history of in the family, they can randomly they can have. Well, this is respiratory allergy. It's not a disease. And one more misconception is it is contagious. No, it is not. In fact, this mother also was very, very concerned. Did it come from his grandfather? Yes, it might have come from his grandfather genetically. Not contagious. You understand? And a lot of people think, okay, it will make him weak, it will make him somewhere lag behind other kids. No, not at all. Asthmatics can be very well lead a normal life. They can perform all the activities, they can do everything. They can even be an athlete in Olympics. You know what I'm saying? So asthma is not a disease. It's an allergy of respiratory system, airway system, which basically reacts to any foreign body or allergens, so on and so forth. In my next video, I'll talk about the treatment, because there's a lot of myths and misconceptions when it comes to treatment, the use of steroid, the role of steroid, the misconceptions about steroid. So we'll talk about it in the next video. Thank you.